Have you ever heard of glycogen storage disease? It's a rare condition, but it's worth understanding. Also known as GSD, this condition affects the way our bodies store and use a type of sugar called glycogen. Now don't let the word sugar fool you. Glycogen isn't the sweet stuff you put in your coffee. It's a form of stored energy that our bodies need to function properly. But for people with GSD, this process doesn't work as it should. You see, GSD is a hereditary condition. That means it can be passed down from parents to their children. It's not something you catch like a cold or develop because of lifestyle choices. It's written in your genes from the moment you're born. There are several types of GSD, each with its own unique set of symptoms and challenges, but they all share one thing in common: the body's inability to properly handle glycogen. So, in a nutshell, GSD is a condition where the body has trouble dealing with a type of sugar called glycogen. Now you might be wondering, what happens when someone has GSD? How does it affect the body? Well, let's dive right into it. Glycogen Storage Disease, or GSD, is a rare condition that affects how the body stores and uses glycogen, a form of sugar that provides energy to your muscles and liver. When a person has GSD, their body, particularly the liver, struggles to break down glycogen into glucose, the body's main source of fuel. This can lead to an array of symptoms, most notably in the liver and muscles. You might see things like weakness, fatigue, and even muscle cramps. There are several types of GSD, but the most common are types I, QI, and IV. Each one of these affects the body differently and to varying degrees. For instance, type I mainly affects the liver and kidneys, while types 3 and IV primarily affect the muscles. All in all, GSD affects the body's ability to break down glycogen into glucose, causing various symptoms primarily in the liver and muscles. So, how do doctors figure out if someone has GSD? And what can be done about it? Well, diagnosing glycogen storage disease isn't a simple process. It often involves physical examinations, blood tests, and in some instances, biopsies may be necessary. These methods help doctors to determine the type and severity of GSD. Once diagnosed, the treatment plan is tailored to the specific type of GSD. This could involve a range of approaches from specialized diets to medications. For instance, some people might need to follow a diet high in protein and complex carbohydrates, while others may require certain medications to regulate their blood sugar levels. In some cases, a therapy known as enzyme replacement therapy could be beneficial. But let's not forget, regular medical care is paramount in managing this condition. Frequent checkups allow doctors to monitor the disease and adjust the treatment as needed to prevent complications. So, although GSD is a challenging condition, with the right diagnosis and treatment, it can be managed effectively. With advances in medicine, those living with GSD can lead healthier and more fulfilling lives. To sum it all up, glycogen storage disease, or GSD, is a rare hereditary condition that impacts how the body stores and uses glycogen. This disease primarily affects the liver and muscles, leading to a range of symptoms that can manifest in babies, children, and adults alike. We've learned that the diagnosis of GSD involves physical exams, blood tests, and in some cases, biopsies. The treatment varies depending on the specific type of GSD, and it can include special diets, medications, and even enzyme replacement therapy. It's crucial to remember that regular medical care plays a vital role in managing symptoms and preventing complications. For those with a family history of GSD, genetic counseling is strongly recommended. This can provide valuable insight into the risks and help in making informed decisions about family planning. This journey into the world of GSD has shown us that while it's a rare condition, its impact is significant for those affected. In the end, it's our understanding and compassion that make the most difference. Remember, knowledge is power, and understanding conditions like GSD helps us all be more informed and compassionate. Thank you for joining us today. Like, share, and subscribe.